In vitro fertilization or any form of fertility treatment must be viewed upon as something as simplistic as a seed-soil relationship. If you're trying to plant a seed in your backyard, you have to have, for it to make a healthy plant, two things have to happen. First, you have to have a competent seed, one that's of good quality, and that's capable of propagating a plant in an ideal environment. And second, you have to have receptive soil. In the case of infertility and reproduction, the seed is the human embryo, and the soil is the uterine lining. So if we want to help people understand how to best achieve the goal of a healthy outcome, we've got to analyze the factors that affect the quality of the seed and influence it, and the factors that will or will not make the soil receptive. 70% of failure to conceive, whether it be infertility or repeated miscarriages, are due to problems with the seed, with the embryo. And about 30% are due to problems in the receptivity of the uterine lining to that embryo. No doubt it's commonly but it can be both. It doesn't only have to be one, it can be both. And our job is to break down those various components and analyze them. How many of you know that a woman is born with all the eggs she's ever going to have? They were in her ovaries when she was 3 months along in her mother's womb. And by the time she gets to the point of going through puberty and ovulating, the number of eggs has probably dropped from an initial 7 million down to about 1 million or so left in her ovaries. And then she uses them up every month in large amounts because nature tends to be wasteful, to try to propagate a baby as young as possible. And then as she uses them up and they fall below a certain threshold, at that point things become more difficult. When she falls below a critical threshold, the brain and the pituitary gland that orchestrates all of the ovulation and everything in the body starts cracking the whip louder and says, look, we're running out of eggs here, start doing something to make more. And that's when changes start occurring that we can measure that indicate that the reserve, that her time is running out, that she's moving into a phase we call the climacteric, which is when there's decline in ovarian function. It's harder for a woman to get pregnant, and when we give her fertility drugs, it's harder to stimulate her. She's running out of eggs, and when she runs out of eggs, that's when everything stops. And the key is that decline in ovarian reserve can be measured in the blood by tests like the FSH, tests like inhibin B, anti-Müllerian. There are lots of tests we can do to tell us when that's happening. But the bottom line is that the ability of an embryo, which is the fertilized egg that is divided to make a baby, largely but not completely, resides in its genetic chromosomal makeup. Every cell in the human body has a fixed number of chromosomes. It has 46 chromosomes, 23 that are lined and stacked on one another in a spiral arrangement. And in order for an embryo to be, quote, competent, which means be able to make a baby, all the chromosomes must be present. You can't have more and you can't have less. If you've got more or less, we call that aneuploidy. And that is a rate-limiting factor in human reproduction. Just happens that humans are the worst reproducers of all animals. In a human being, even at 30, only 1/3 or 2/5 of a woman's eggs are normal. You look at a rabbit, 98% are normal. You look at a human, 1/3 is normal. And when she gets to 40, maybe 1 in 7 or 8 is normal. And when she gets to 45, only 1 in 25 is normal. So with advancing years through wear and tear, the quality of the eggs decline. And because it declines, the ability that egg will make a competent embryo when it's fertilized reduces. And that is why as women get older, it's harder to get pregnant, it's harder to stay pregnant, miscarriages are more common, and sadly, certain defects that are associated with abnormalities in the chromosomes are more common, like Down syndrome. So age is a factor, and the main factor that determines the competency of women's embryos. And it stems from the normalcy of the egg, not the sperm. We men may think that we play that vital role in determining whether an embryo can make a baby, but factually, It's the egg. It's almost as if it's got a little peephole that it can look through the shell and see all the sperm trying to get in and say, this is the one I want because it's a good one, and bring it in and make that choice. Obviously, if the man's infertile, then it's more likely that the choice won't be a good one because there won't be good ones around. And so the sperm can play a bigger role in influencing whether the embryo is competent. But by and large, it is the egg and its chromosomal integrity that determines if a woman will be able to successfully have a baby in 70% of the cases.